To ensure safety and appropriate dosage, it is really important that you see a healthcare provider before starting this medication. Hello and welcome back to another video. If this is your first time coming across this face, coming across my video, my name is Victoria. I'm a nurse practitioner, a content creator, an entrepreneur. I talk about nursing, beauty, nutrition, and lifestyle. Any information that's gonna benefit your health and wellness, I love to share, okay? So with all that being said, and without wasting much of your time in today's video, this is part 2 of Enlarge Prostate video that I posted yesterday, okay? And the part 2 contains the diagnosis process and also the treatment options that are available. There are so many treatment options available, but today I will be discussing 8, okay? I'm not giving you 2, I'm not giving 3, I'm not giving 4, I'm not giving 7, I am giving you 8 treatment options. So for proper treatment to be achieved, we need to have proper and accurate or correct diagnosis, okay? So this health condition is only in men. The first test that the doctor is gonna ask you to do is digital rectal exam. How is digital rectal exam done and what is the purpose? Digital rectal exam is when the healthcare provider is gonna use their finger and insert inside your anus, okay, checking for the size of the prostate, because the prostate is below the bladder and close to the rectum. So when they put the finger inside your anus, they're gonna be able to palpate and check, okay, the size of the prostate. After that, that is not the confirmatory test. After that, they're gonna do another test. Prostate specific antigen is a protein that is produced by the prostate. The higher the level of this antigen in the blood, then it signifies that there is something actually going on in the prostate, okay? So this is done through blood. They're gonna draw your blood, send it to the lab, wait for the result, and now your doctor is gonna call you to explain the result to you, okay? And the purpose of doing this is to rule out prostate cancer from benign prostate hyperplasia or enlarged prostate. When you do the test, the doctor is gonna be able to tell, oh, okay, maybe this is prostate cancer or this is benign enlarged prostate, okay? Another test that will be done is ultrasound. Ultrasound is actually to see if the prostate is actually enlarged or there is a tumor inside the prostate. If the prostate is enlarged, then the disease is enlarged prostate. But if the prostate is normal but there is a tumor inside the prostate, then cancer is suspected. And further tests will be done to rule out enlarged prostate or to rule out cancer. These are the 3 tests that I'm sharing with you today for the diagnosis, but that's not the only one. There are many more, okay? But we're gonna stick to these 3 because these 3 must be done, okay? Including the rest of them, but this is the 3 specific ones that must be done each time that you wanna rule out this disease or you wanna confirm this disease, okay? Enlarged prostate. So when this disease is confirmed and the doctor tell you, hey, you have enlarged prostate, okay? What are the treatment options available? Today, I'm going to be sharing 8. The first thing that the doctor might tell you is watchful waiting, depending on the case. If it is a mild case, you might be able to, wait while your healthcare provider watch you to see if it's going to progress or is not, okay? That is the stage of watchful waiting. And watchful waiting is not determined by you, it's determined by a healthcare provider. They're going to check, do the test, do some assessment to see if it is something that you really have to wait for or something that needs immediate treatment. So number 2 is that there are medications can be used to manage this disease, okay? Please, to ensure safety and appropriate dosage, do not go over the counter to buy these medications. Depending on country where you live in, here in the United States, the medications to treat enlarged prostate are not available over the counter. You must get it from a healthcare provider through prescription. So depending on where you're watching me from, never go to buy this, okay? For your safety. It might be cheaper where you are to buy it over the counter, but please go to a doctor for appropriate dosing, okay? It's really important. Your safety is really important. And also to know what you're allergic to, what to avoid while you're taking the medication. Those things are the education that a healthcare provider will give you when you go to them, okay? It's really important. When you have serious health conditions like this, don't play with it. Go and see a healthcare provider, okay? Avoid fluid at night. You know the bladder cannot really expel the urine as it used to because of the blockage, so it's not wise for you to be drinking a lot of fluid at night. Avoid alcohol, avoid caffeine, okay? Because if you keep drinking and it's not coming out, guess what's gonna happen? You will continuously have urge throughout the night, and the urge will continue to interrupt your sleep, and you will never get rest, plus the waist pain that comes with full bladder, okay? UroLift system is the number 4 treatment available. This treatment method lifts and holds the enlarged prostate in place and out of the way, okay? If the prostate is closed like this, with the UroLift system, this is a technique that opens it up and keep it separated like this so that urine can flow from the bladder, okay? That's one of the treatment options. Number 5 is aquablation therapy. This is a therapy that uses a robotic heat-free water jet for a precise tissue removal, and it's done in the hospital, okay? After this procedure, the doctor will insert a Foley catheter. The Foley catheter stays in your bladder and collects urine by itself for about 7 days. After 7 days, you go back to the hospital, okay? So the urologist can assess you and check. After they remove the Foley catheter, after they see you, they're going to offer you a lot of water. You will drink a lot of water so you will have pressure to urinate. And the purpose is that they want to see you urinate by yourself to make sure that things are working before you get discharged home. So as soon as you urinate by yourself with no issues, they see that urine can come out without the Foley catheter, then you will be sent home, okay? And the healing doesn't really take time, all right? The next one is transurethral resection. Is a surgical removal of the inner prostate tissue, okay? Remove and done. The last one that I'm going to discuss today is laser therapy. Laser therapy uses high energy laser to remove prostate tissue. During this process, bleeding is very less and the healing is fast. That will bring the part 2 of this video to an end. I will be bringing more of these health related topics, okay, to discuss with you guys. And if this video resonates with you, or you know someone that you can share this video with, go ahead and share with them. And I'll see you all in my next one. Bye.